most importantly, what we would like for you all to do. Hi, my name is Edith Kenna. Hoosiers for a Common Sense Health Plan welcomes you here today for our first Town Square rally. Maria Parra and Pat Moore did a great job in getting this together, and let's have a round of applause for them. Now, the health insurance and pharmaceutical companies tried to hijack the weather, and Maria and Pat have gotten a piece back, but you know, we got mighty enemies to fight out there with lots of dollars. I have a written up little speech because those who know me know I am a rabid dog on this issue, and I am going to try to keep myself in line. Let me tell you just a little bit about Hoosiers for Common Sense Health Plan. It was born in Bloomington in 2005. Dr. Rob Stone, his wife Karen Greenstone, and a few of his associates and friends got together and started to form a movement for single-payer universal health coverage. Dr. Stone is an ER physician in Bloomington Hospital, and with a 25-year history of service in emergency medicine, and he was sick and tired of the sick and tired and the uninsured coming into the emergency room way long after they could get the kind of help they should have had they had health insurance. Today, Hoosiers for a Common Sense Health Plan is a statewide movement of people just like us. Old people, young people, middle-aged people, all races, all religions, blue collar, white collar, who believe that each of us is worthy and valuable to have health care when we need it. Now, our Congress and elected officials maybe have missed this point since they have managed to cover themselves with health insurance, and some of them for the rest of their lives. But they forgot about us. Congressman Souder, after our last press conference from Dr. Jonathan Walker's office, a member of Physicians for National Health Program, Congressman Souder said what Michael Moore is talking about is quote-unquote stupid. Now, I know this to be true because I bought the news tape and have looked at it several times. Because if he thinks health care for every single one of us is stupid, I can't say anymore because my boss is here. Hoosiers for a Common Sense Health Plan has focused on one thing and one thing only: a common sense health plan, a single-payer, universal health plan, preferably enacted by federal legislation that would be most equitable and the most cost-effective. However, if we have to go state by state, as Canada did, province by province, then we'll do it that way also. Only one piece of legislation is in the federal government now. Only one proposal that is single-payer, universal, from any of the presidential candidates meets single-payer, universal criteria, and that is H.R. 676, Medicare for All, introduced in 2003 by John Conyers of Michigan, and the first person to co-sponsor was Dennis Kucinich from Ohio. It has been reintroduced into the House Ways and Means Committee again this year. 7 years and no hearing. 7 years in no hearing, even while there are 47 million Americans with no health insurance, 860,000 Hoosiers with no health insurance, and documented 18,000 deaths, documented by Physicians for National Health Program, 18,000 deaths annually because people have no health coverage. Now, if 72,000 people drop dead in front of our face, like what happened on 9/11, we might be having a few hearings. The World Health Organization does not rank the United States as #1 in health care. We are ranked 37th, right after Costa Rica and right above Slovenia. Now that works for me. We are, however, number one in spending on the most for health care. $1.918 trillion with 47 million people without health insurance. Now, the PTA treasurer of Bunch Elementary School wouldn't run the PTA like that, but apparently that's how our legislators like to run this government. We do not need our system of illness management. We do not need health insurance as we know it. Expensive, inadequate, unavailable when you need it, hard to get and easy to lose. We must have a healthcare system that is accessible, affordable, portable, equitable, and of quality. Let me say that again. Accessible to all, affordable for all, portable for all, equitable for all, and of quality. Single-payer universal care is no partisan issue. It is an American issue. America will not, cannot be strong unless its businesses and its people are healthy. We cannot do it if we are sick. This is a sick system, and our government's implementation of healthcare policy is sick and makes us sick. Come to the table and introduce yourself to us. Join us. Be a Hoosier for a common health plan. Sign our petition for H.R. 676. Call your congressman. Remember, one voice is a whisper. Many voices become the wind. Let's make a Hoosier hurricane. Thank you.
Where do we sign? Where do we sign the petition?
Sign right